The owner of a pediatric dental practice in Yarmouth says insurance hang-ups are forcing him to wait months in order to care for kids who he says are in immediate pain. As News Center Maine's Pearl Small reports, it's a statewide problem that goes back to how MaineCare covers certain services.
These are treatable problems. There's nowhere else in medicine that we tell a kid that you have to sit in pain with an infection in your body for months on end, and we're not going to do anything about it.
Dr. Michael Dowling, who owns 207 Pediatric Dentistry, is flipping through a book of just a small portion of his most serious cases, which all needed general anesthesia.
This is a 3-year-old that, needed 6 teeth extracted.
All these kids and around 50% of his patients are covered by MaineCare. And every time they have to put one of those kids under for treatment, the practice loses hundreds of dollars because MaineCare doesn't fully reimburse for the cost of anesthesia.
It's really a matter of the state fulfilling its obligation to its children and its special needs population.
Currently, dentists like Dowling have to limit the number of MaineCare patients they see. The result is kids sitting on wait lists.
Yeah, 8 months is a long time to be seen to fill a cavity.
3 of Sarah Eller's kids have sat on wait lists because they needed anesthesia. Her daughter just recently got back on a wait list again to fix crowding in her mouth. But the wait is so long that by the time she's seen, her adult teeth could have started coming in crooked.
To have it cover more so that more money goes back to the dentist, I think would open up a lot of doors. I think more people would start accepting it, and the wait times wouldn't be so long, the kids wouldn't be in pain.
The Maine Dental Association estimates thousands of children are currently waiting. But Dowling says he could really make a dent in the need. His practice in Yarmouth recently built a brand new surgery center just next door. He says it eliminates the costs and scheduling conflicts that come with having to rent a hospital operating room.
We have other pediatric dentists, oral surgeons that have said that they'd be able to see more MaineCare patients if they're able to utilize our space.
But in order to let other dentists use the facility, he needs to bring in anesthesiologists. And in order to pay for that, he says MaineCare needs to increase their reimbursement rates. A representative for DHHS says MaineCare rates will go up 1% this year for cost of living, but other adjustments will have to wait until their formal rate reform process, which they have moved up 1 year to 2026 in order to address these issues sooner. But Dowling's concern is that there's still no guarantee rates for anesthesia will go up or by how much.
This isn't just us saying, this is a problem. This is us saying, this is a problem, this is a solution. All we need is the state to help us get across the finish line to fix this problem.
In Yarmouth, Pearl Small, News Center, Maine.